Tumela Matako, hi, and welcome to Mommy Diaries. We know this show, we talk about all things motherhood, parenting, and this amazing journey ya uhudisa bana barona. Today, I have a gynecologist, Dr. Rubushe-Ngwenya. Welcome, doctor.
Hi, Pasi.
How are you?
I'm fine, thank you.
Are you fine for real? Because most of the time I always ask my guests, how are you? And I always get the same answer. I'm fine.
I'm tired.
Yeah.
But I'm fine.
I'm also tired.
Yeah.
But I'm fine.
But we're fine.
We're fine.
I mean, we make it, we mommies.
Yes. Tell me a little bit about yourself. Kimam Dr. Bongi.
So I am obviously obstetrician gynecologist. I am a mom of 3.
Oh, yes.
Yes. My eldest is 18 this year, and then I have a 8-year-old and a 4-year-old, 2 boys and a girl. I love what I do as an obstetrician and a gynecologist. I'm more a gynecologist or obstetrician. People always just call us gynies. Obstetrician is more on the birthing side. So we'll take care of mummies that are pregnant throughout their journey. And then the gynecologist is then mummies who have problems in terms of their reproductive system and everything like that. I love both because I love pregnant women. But yeah, so I work in state and I also work in private. I'm based in Parktown, Park Lane Hospital. And I also, I did a lot of state. So Baragwanath Hospital, and then all the other hospitals around.
And have you always wanted to be, before Dr. Bongi, when you were little Bongi, have you always wanted to be
a gynecologist?
A gynecologist, yes.
Well, a doctor, yes. Because I remember in, standard 7 then, but when we chose our subjects, I chose it knowing that I'm coming in. And even when I got to grade 11, when I had to choose my where I'm going to study, it was always medicine.
Yeah.
And I fell in love with gynecology during my rotations as a student. And I knew I was always coming back. It's just something so fulfilling and so beautiful about having to help a mom through their journey of pregnancy and then the life that they bring. I just,
Yeah. Now, going into today's topic, sexual health.
Yes.
Let's talk about that. Like, what are some of the concerns that you always come across about the topic, the sexual health, when it comes to women after giving birth?
So, we are all very shy when it comes to sex.
Yes.
That I have picked up across the board. Where even older ladies, even younger ladies, everyone is very shy. I think society has put it in us that, sexuality is, yes, it's part of us, but, you can't be forward when it comes to sex, you know. So that's the one thing I've always noticed. And after childbirth, there's just so many issues that come into play. Your body's changed. You've gained a bit more weight. You don't feel sexy enough. You don't know if your husband or your partner is going to want to have sex with you. And so you keep all of those bottled up inside. And then there's all the other stuff. So the leaking breasts, the bit of bleeding that comes with it, and the little scar if you've had a cesarean section. And so that can all hinder your ability to want to be sexual post childbirth. And I find that it's a lot in us, as ladies.
So does it differ person to person or woman to woman? Because some women, I remember when I was pregnant, I did not want to have sex. But a friend of mine was like, hey, she wanted it, waya gumba fire. So is it because of there was something wrong with me, or we just different?
No, I think it's just different, generally, there are people, even pre-pregnancy, who have got high libidos than other people. And then that can also translate into the pregnancy period. Or even vice versa. You had a high libido prior, and then during pregnancy, your libido drops. Or the other way around, where it goes higher. It also comes into play in terms of your hormones as well. That then affect you and how you feel, then wanting to have sex or not. So it's not anything wrong with you. It's just different from person to person.
And how do we communicate these things with our partners? Because like you're saying, sometimes we are shy to talk to you as a gynecologist or you as my doctor with my partner that, things have changed. I don't feel like I want to have sex. I don't feel like having sex. But like men are different.
Yes.
If sometimes when they want to have sex, they want to have sex.
Exactly.
Yeah.
It's so important. Communication is so important, Pasi. And we take it for granted that he will understand. Or we take it for granted, or we assume, for example, as I said, you not feeling sexy enough, you don't think that your man wants to have sex with you. And so then we kind of shy away from it. Sometimes it might be reverse, where I have partners who come into the room to say, I'm so scared to hurt the baby, so I don't want to have sex, And or if a woman is having a lot of complications during their pregnancy, or they've had previous complications, like they've had previous miscarriages or babies that didn't, they didn't bring babies home. And so in that pregnancy, they think that me not having sex or me not putting the baby in danger, and sometimes sex can be seen as putting the baby in danger. And so they shy away from having sex. But it's so important to communicate those things, because you're, especially with your doctor, your gynecologist. Yes, there are some instances where we will say, please don't have as much sex as you would, or please refrain from sex for a period of time because of whatever medical condition that there is. Like if someone had a threatened miscarriage, or maybe somebody's got incompetent cervix or something like that. So there are instances where we would say, but in general, sex can be had in pregnancy.
We had to change mics because technical issues. Anyway, doctor, let's talk about when is the right time to start having sex after a woman has given birth.
Yeah. So this question, I especially get it from our dads, They always want to know, I've been going through pregnancy, no sex, and now we're here. So generally it depends on a few things, okay? It can depend if you've had normal delivery or if you've had a cesarean section. It also can depend if you've had complications in the pregnancy or not. So we normally just give a round figure of about 6 weeks, because we know that's the amount of time that you can take in order for you to be able to get back, your body recovery of the body after you've had your baby. But you do have some people, especially if you had a normal delivery, no complications, and you're back to yourself much quicker, that they do sometimes have sex much quicker than that. So what I always say is that make sure that you are protected in the sense that you don't fall pregnant in that time. You know? But generally about 6 weeks is a safe time.
Yeah. More and more women are giving birth cesarean these days. It's not like before, where it was not necessarily the only option, but a lot of times we were advised to give birth naturally. Yeah. But we also have these conversations as women that, now I'm scared to have birth natural, because the vagina might stretch and not come back to its natural. Yeah, is it true? Does it change? Sometimes we do have these conversations. We're like, natural me. Yeah. I don't want to give birth natural, because what if it doesn't come back to its natural?
So obviously there's a lot of changes that happen. Yeah. Okay, and then things will never always go back to 100% normal. Okay, but the vagina, yes, it stretches, but your body is built to accommodate that when you give birth, and you do get a lot of normality in terms of the type of epithelium and everything else in the vagina. It's designed to stretch to give birth to the baby, and then it'll still come back. Okay, so not that it'll be 100% like before or anything like that, but I think we emphasize too much when it comes to that, or and also, postpartum, when it comes to sexuality, that's what people always worry about. Am I not going to be able to satisfy my husband like I used to, or my partner like I used to? Is now me giving birth not going to cause all of those troubles? But we've had lots of couples who come back after having normal vaginal delivery who are happy, in terms of their sexual life and sexual practices. And I don't think it's something that you would say equals to kind of thing. Yeah.
And how can our partners support us? Because like you're saying, there's so many changes that are happening. You've just given birth. You are going through the most. There are changes happening on your body. How can our partners support us as women when we're going through all of that? Some women, you would hear them say pressure from their husband.
Yes.
How can they support us?
I think communication is the first. That's key. And I think more dads need to be involved in the journey of pregnancy and knowing all these changes and complications that happen, Some might be only psychological and mental, but others might be physical. And so when a woman has a lot of complications, then they tend to shy back, shy away, or draw back, And so when you have a partner who is through the journey and understands what is happening to their partner, their wife, and all the complications and has conversations with the gynecologist when they go for the checkups with the baby, I think they will then understand better that, okay, this is what my wife is going through now, therefore the pressure is not good in terms of that. All right. So I think them being more involved and understanding goes a long way than me bringing back information to say, this is what the doctor said. I've actually once had a patient where we had done something completely different from our childbirth who said, Doc, please write it in the file. Write it in the file that this is what you are now recommending, instead of me having a conversation like this, so that my husband can see it.
Oh.
Yes. Because sometimes men don't understand, so I think being involved more with your partner, with your wife, knowing what they're going through, whether it's mental or psychological or physical, Yeah.
And I think, like you're saying, because it's a journey, it's not like you get pregnant in 2 minutes and then the baby's there. It's a journey. And I think if your partner is with you throughout the journey, from the beginning, because sometimes you'll hear, mina ngumZulu, I don't attend these
things.
They don't attend the visits to...
And then ultrasound.
And then ultrasound, that's the only way you'll be able to understand the changes and understand, that's why this is happening. Because if you're the only person going to these visits, then I'm going to have to ask you as a doctor to write so that I can show him and so that they can understand.
Definitely.
Yeah.
And also I think dads bond better when they watch their little ones grow in the tummy and they see the scans, and then it's always exciting when they say, then they start identifying the things when you scanned, like, this is, you said last time, you said, they take pictures, they're quite excited, and then they bond better. I think that communication and that closeness and them being that involved goes a long way in their pregnancy.
And then are there exercises that women can do, let's say, for example, like we say, around the sexual health thing, like any exercise that they can do that can help?
Exercise in general is a good thing in pregnancy and even post. I mean, the endorphins that come and also just feeling healthier, walking. It doesn't mean that you must start running marathons, but walking around, afternoons, in the mornings, then you can do that. But most importantly, you want to be able to strengthen your pelvic floor muscles. There's something called Kegel exercises where you hold and you release, you hold, you release, and you do that over a period of time, and it strengthens your pelvic floor muscles, because yes, you will have a little bit of laxity in your pelvic floor muscles from having delivered, normal delivery, and then that goes a long way to try and strengthen your pelvic floor muscles. Also, when it comes to post-delivery, some people might say, I feel like I can't hold my urine hold my urine as well as I used to before. And so the Kegel exercises go a long way to be able to help with that. And so you find that some people will start it and then they won't finish, they'll forget to do it. But I mean, if you remind yourself to do it on a regular basis, it helps.
So you can just do it anytime when you're sitting, or is it something that you like? If you now I'm sitting, I must.
You can. So I mean, if you have a schedule, sometimes they'll say you do it morning and night. Sometimes they'll say when you're going to the bathroom to pass urine, then you can do it. Then hold your urine, teach your brain, and then release. It helps. So I think the easiest way when you remember is if you're taking your tablets, take it like that. I'm taking my tablets in the morning and the afternoon. So in the morning, part of my routine, then I do it. And then in the afternoon, part of my routine, I do it, or in the evening, whenever you're doing it. That way you won't forget. Because it's part of then the journey or the, medication that you're taking.
And then, most with our culture, after you've given birth, sometimes you go home so that your mom can take care of you and whatnot. But sometimes you would hear things like, they would take us away from our husbands because you might make another child very quick because you've just to explain the biology side of it, because after giving birth,
Yeah.
you have to go home.
Yeah.
That's a sort of at home, and then your mom will give you doggo and all of that, but you leave your
Yes.
husband
Yes.
at home, and then you'll come back. I don't know after how long. So, is it true that after giving birth, it's quicker for you to fall pregnant?
You can fall pregnant soon after you've given birth. That's why we always say to the ladies, that's why even earlier on I was saying, please make sure that you are protected during that time in terms of contraception.
Got you.
Okay. I think also people also have that notion that exclusive breastfeeding was going to take away my ability to fall pregnant.
Yeah, because I didn't go on my period for long when I was breastfeeding. I was so happy. I didn't like, I was so happy. Imagine you're breastfeeding and you're not going on your period. I'm like,
You're just
yes,
like happiness.
would not.
Yes. So I think part of then going home is sometimes you don't exclusively breastfeed.
Right.
But now you're breastfeeding and you're thinking, oh, I'm breastfeeding, so therefore I can't fall pregnant. But now you are supplementing the baby's feed, you're not exclusively breastfeeding, you're not producing the hormones as much as you're supposed to. And so you can actually fall pregnant, you know. And what people don't understand is that you ovulate before you menstruate.
You ovulate before you menstruate.
Yes.
Okay.
And so you can fall pregnant before you've actually seen a period.
Wait. So
You ovulate?
let's say I'm going on my period next week.
Yes.
So this week, when am I ovulating?
So, okay, so if you've got a perfect cycle,
Yeah.
we'll say like 28 days
Yeah.
cycle, right?
Yeah.
And then so 1, 2, 3, 4, 5, let's say how many ever days you menstruate. And then on day 14, you're supposed to ovulate.
Yes.
Okay. And so if you then start your cycle before that and you ovulate before you menstruate, because remember, your balance and your hormones go up or go down depending, and then they build up your endometrium. And then you release your egg for ovulation. And then after that, if you don't fall pregnant, then the withdrawal of those hormones will then cause you to bleed.
And then after bleeding, you might find out you are pregnant.
No.
Oh.
So what I mean is that, so then you haven't fallen pregnant. Okay.
yeah.
But if you are then constantly having sex and you ovulate, you're not going to see a period because now you're pregnant. That's why we always say as gynecologists, come back for our 6-week visit. Let's have a conversation. Let us see where you are in terms of your sexual health. Let's see, are you having sex already? Are you not? All right. And if you are having sex, are you well protected so that you're not falling pregnant immediately? You know, especially if you had a cesarean section. Imagine now you're pregnant, you've got a small baby, you're trying to nurse a wound, and you so it's very important to be able to protect yourself.
So after having a cesarean, when, let's say for example, some people are planning pregnancies, I want to have another child after another child.
Yeah.
When is the best time to start planning for the next one if you've given birth with cesarean?
I mean, there's a lot of talk around that, you know. So you want to be able to give yourself enough time for healing process to happen, okay? And maybe about a year and a half. Okay, it could be fine. Sometimes we'll say a year and a half just to give yourself enough time to heal. But so I think also the pregnancy spacing comes into play in terms of if you had complications before, you want to be able to give yourself enough time to, if your baby's still breastfeeding, you know, are you back to normal working environment? Are you guys then at a place where you can have another baby or not?
Yes.
So all of that comes into play. But we generally say about a year and a half, more towards a year and a half,
Now, talking about contraceptives, like, do they really affect your libido?
They do. It's one of the complications. Well, not complications, but side effects.
Side effects,
Of taking contraception.
All of them or certain?
Some of them more than others.
Yeah.
So some of them will affect your mood more than others. Some of them will affect your libido more than others. But to a certain percentage, most of the contraception will, to a certain extent, affect your libido somehow.
Yeah.
Okay.
And how do we have these conversations? Because we spoke about communication. How do you have these conversations with our partners? Again, now you're taking contraceptives, it's affecting your libido. And then the next day, because when you don't feel like having sex. Not because you don't want to.
Yes.
I've been on contraceptives and I know, like, it's been a month and I'm not even thinking about sex.
Exactly.
And then we sometimes as people, we don't read. As my gynecologist, you will say, I think this is the best contraceptive for you. And then I trust you and I don't read. Or maybe sometimes some gynecologists don't explain thoroughly these are the side effects and this will affect you this way.
Yeah.
So how do we communicate with our partners that, babe,
It's not me, it's the contraception.
choose your struggle, because if I'm not on the contraceptives, it means
Then
that re tlo ba le
fully
ngwana.
pregnant.
Yeah.
Yes. So I think also part of the involving the partner when you go for these follow-up visits, you know, so then they can hear what the side effects are, you know, so that they understand. Sometimes people just don't understand, even if they've been to the consultations, okay? So I think then being cognizant of the fact that you are going to have a decreased libido, so then you work around that with your partner. So sometimes people say you don't schedule sex, you know, you can't do that. But sometimes you might even have to get to a point where you have to do that because you know your libido is low. So it's not that you don't want to have sex, you're just not thinking about it because you're on this contraceptive pill. And so being cognizant of that, having your relationship, you know, step up in terms of this is what we're going to do, this is our time together. And so having sex at those times or exposing myself to have sex at those times is important, you know?
Like maybe setting up the mood.
Exactly.
Yeah, because I think people think when you're scheduling for sex, like at 10 o'clock, then
Yeah, let's
what
go.
do I do with myself? But I think like what you're saying, setting
Yeah.
up the mood.
Yes.
And also because sometimes you do get dry from these contraceptives, and then it's
Yes.
like it becomes uncomfortable and painful. And sometimes some women are even scared to tell their partners that I'm not enjoying this.
Yes.
Yeah.
So I always say to my ladies, you know, especially the people who are trying to fall pregnant, plan your date nights around that. You know, you are supposed to be having date night with your partner anyway, so that you guys can be able to connect. So then plan date night instead of making it like once every 6 weeks. Make it much closer, you know, every 2 weeks, every 3 weeks, and then you having that connection will then make you want to then, you know, have sex. Because sometimes if you're not having that connection and you're not communicating well, and, you know, so then you forget also then to have sex, you know. But if you if you are actively thinking about, I want to make sure that my partner and I connect in the right way. So planning date nights, making sure that you during the date nights can have an happy ending, you know, that's good. You know, then you will be able to have more sex, even though you are not, you know, you have a decreased libido, okay? And then also being open to trying new things, you know, in order for you to be able to have sex, you know. Uncomfortable sex is not the right type of sex. And if you do tell your partner that, okay, I know that before the contraception, I used to only require a small amount of foreplay in order for me to be part of, you know, the sexual experience. But now I need a little bit more foreplay, you know, switch things up, you know, use other things like maybe your toys or something else. Use lubrication if you need to. I mean, there's nothing wrong with introducing other things into your sex play so that you are able to enjoy sex, you know, even though there's a bit of a decreased libido.
Hormones, like hormones. Dr. Hormones king, and why hormones? Like every time you just hormones. Like, you know, I have older friends and they're going through menopause. Hormones. The hormones is king, and like why do they come up all the time? Hormones are changing. Maybe it's your skin, you're breaking out. The hormones. I have beard. Hormones. What's the hormones?
So basically your hormones, they produce so that they can be able to balance your entire existence, basically. Okay, so when that balance is not correct, that's when you start seeing adverse effects, as you said. Okay, so when you have like really heavy periods or no periods at all when you're supposed to be having periods, that's a hormonal imbalance. All right. And then when you break out, or you have your ladies who we have polycystic ovarian syndrome, where then instead of making the female hormones a lot, they make more male hormones, which is your androgens. Hence, you see the beard that they form, the alopecia that they have. Okay, and then the hair distribution that looks like male, and then subsequent to that, they then have the irregular periods. Okay, and then subsequent to that, they have affecting their fertility. All right, so hormones are basically what runs your life, which is, so you've got your good hormones. They don't really say you've got bad hormones, but you have your good hormones, which then balance. Even your period is balanced by your hormones. So your estrogen, your progesterone, and then when each one of them peaks or they drop, that can affect your mood, which is similar to when after you've delivered. So in your postpartum period, you've got this progesterone and this estrogen, which has been climbing and climbing and climbing, going higher, because it's produced by a placenta for the pregnancy itself. Minute you deliver, completely drop, because now you don't have your placenta anymore to be able to produce that, and that's what can cause the anxiety or the depression that comes post. Okay, and then you have some hormones which help in terms of like your oxytocin levels, some maybe like your prolactin levels. So that's why we like our moms to breastfeed also when in the postpartum period, because yes, that helps in terms of you bonding with your baby, but it gives you your good hormones, your healthy hormones, your bonding hormones, your feel-good hormones in terms of oxytocin. So the skin-to-skin that comes with it, the breastfeeding that comes with it, it really goes a long way. So promotion of breastfeeding, not only for the baby, but also for you to be able to stabilize or have counter hormones to the drop that you get immediately post-delivery. Yeah. And then, as you said, the menopause part that comes, where you're there again, you're not producing your estrogen appropriately, you have your high LH and FSH levels, and so then you go into the menopausal stage, because, estrogen is what makes you basically into a woman.
For someone who doesn't know what estrogen is, what is what is estrogen?
So estrogen is actually the hormone. So we like to say it's the woman hormone, to give you the good skin, to in terms of your libido, it will, when you start having sex, nice vagina, so when you go into menopause, you have all of those symptoms where you have your dry vagina and you've got your hot flushes and all of that. It's because you've got decreased levels of your estrogen. Okay. And so you can't run away from your hormones. And some people experience it at different levels, in terms of the hormonal imbalance that then brings on all of the adverse effects.
Is there a woman out there who has their hormones balanced? Or we all have that?
It will always fluctuate.
Got you.
The fluctuation is what happens in order for you to be able to have a normal menstrual cycle.
I hear you.
Yes.
Yeah.
So at any given time, in terms of, we say your entire cycle from day 1 to day 28, in any given time, you've got a different balance. That's why you'll find that you are a little bit more irritable, a little bit more angry. They'll say it's PMS if you're going towards your period, because... or you're a little bit more emotional. Yes. So that's a different balance in your hormones that's causing you to be able to have that. So
lack of knowledge is something else, because when we were young and our moms didn't know, I don't remember my mom saying she's going to a gynecologist.
Yeah.
And I think it's like lack of knowledge, and secondly, some people think gynecologists give for private hospitals only. There are no gynecologists go public hospitals. But I remember when I was young, when you are PMSing, when you want to lock yourself in the room and it's like, oh, so papa janong,
exactly.
And then you also don't understand what's happening to your body.
And it's just where you are in terms of your cycle that's causing you to have that, and also, like, when you reach menopause, you say, oh, people are mean, older people are,
especially at a workplace, like, older people are mean.
Exactly.
Flashes.
Yes. And so when you come and then you see a gynecologist, then we then help you in terms of that, because even post the menopausal part, there are a few things that we can do in order to help with the, with the dry vagina, because it doesn't mean when you get to that age that you can't have sex anymore.
Absolutely.
And if you are having hot flushes, we can help with that, okay? And so come see your gynecologist. Let them help you then in terms of balancing those hormones, or helping you in terms of mitigating all those things that come into play because of your hormones.
Yeah. And what's your role in a woman's life besides the reproductive
health kind of thing? I think when a woman wants to go to a gynecologist, that first step and that first thought is already a health conscious thought. And so you will then want to live a healthier life in terms of that. It's so funny when someone's like, oh, I've started gym because, then I see their doctors more often. Or I went to my gynecologist and they said I should do A, B, C, D, E, in terms of my lifestyle modification. And so that's the first thought. You live a healthier life, all right? And then also tackling all the preventative things that you come into play. If I'm going to go see a gynecologist, I'm going to tell you, let's do a pap smear. Let's make sure that there is no cancer that's sitting there, because you want to be able to treat a precancerous lesion than treating somebody with cervical cancer. Okay, you go to a gynecologist and you just going to see, I'm going to scan you, okay? If you've got fibroids, even if they're not symptomatic, I'll be able to see them, okay? And then we can have all those conversations about fertility. I mean, we can't run away from the fact that now women are more career-driven. Yeah. And so we are having our babies at a later stage in life. But that doesn't take away from the fact that the later stage in life, you will struggle a little bit more than somebody who's young to be able to make babies. And so if you add a factor of fibroids or adenomyosis or endometriosis to the mix, and you're coming to me at the age of 36, 37, 38, or even 40, it becomes a longer and a more costly journey to try and fall pregnant, So basically mitigating things that can come, like prophylactic things, finding problems that maybe you didn't know were there, getting the right type of advice in terms of how to then preserve your fertility or to find out if you can actually be able to fall pregnant or not. I mean, no one can give you that answer 100%, but if you do find something that we can work towards, can fix, then I think the role of a gynecologist is also quite important because in our society, we have a lot of teenage pregnancy, and funny enough, when we see teenage pregnancy, especially now, you will have girls who say, I didn't know I would fall pregnant.
Yeah.
And sometimes you're thinking, but there's so much education out there. But when you think about that, think about the education that you're actually getting. Yeah. We're getting education from our phones. Sometimes we might get things on the television, but if you're not cognizant enough to know where to go to look for that information, you might not have it. Okay, and worse off, then you put me into a rural area where I have no sort of structures in place, and not to say that our schools have to, but they also play a role in terms of education, in terms of knowing about my sexual health and reproductive health and all of that. So I think education is quite key and important. So that's the role I can bring, onto the table. And also being able to help keep you healthier, anticipating problems that can come, at a later stage in your life that you can pick up at an earlier stage, Yeah.
So as a mom to a girl,
Yes.
I always wonder, when is the best time to take your child to the gynecologist? Because sometimes when we were young, we were told, if motayago gynecologist, maybe they're sexually active.
Yes.
When is the right time to take your child to a gynecologist?
Firstly, I think it's important to know that even if you've started your period, you can then sensitize your child to knowing that a gynecologist is there to be able to help in terms of any period-related problems, okay? I think also like the background of someone saying periods are painful, deal with it, and periods can be heavy, deal with it, You could find that there's a problem, okay? Periods can be painful, yes. I mean, you can have your mild period pains, but once your periods become very heavy and they become very painful, that's not normal, okay? And there are ways in order to deal with that, okay? So, and also, you'll have somebody who'll come into my rooms at the age of 21, and they say, I've never had my period before, okay? And I've never menstruated. But why are we waiting till the age of 21? In order for us to be able to do that, come earlier, because we know that we can have a period around about the age of 13, 14. But if you're hitting the age of 16, 17, 18 without a period, bring your child into the gynecologist. Let them have a look and see. Maybe they might have delayed puberty if they don't have all the other things like all the other sexual, secondary sexual characteristics, like your breasts and your hair and everything else. But if they do have that, but they're not menstruating, then maybe there is something that we need to look for. If your child is having her menstruation quite earlier on, before time, less than the age of 8, 6, if they're bleeding per vagina or anything like that, take them to the gynecologist. Maybe they might have what you call precocious puberty, all right, where you have young girls have puberty too early. All right. So I think it's quite important as moms to be able to introduce our kids to this type of care, so that they know that if there's anything wrong with my periods or anything like that, I do have a gynecologist that I can actually be able to go to that can then help me with all of these things. Yeah.
Now, lastly, mental health is it's a serious conversation. Like, it's important to take care of your mental health.
Yes.
And now what we spoke about the sexual health and all of that, after giving birth, you're going through the most.
Yeah.
It's your hormones have changed. You now have to adapt to one thing, and there's a lot of things that are happening. How do you, like, besides obviously there are psychologists and all of that, but like, how do you help your patients who are really going through a lot at the same time, also including the whole thing of now they can't have sex and they're worried? Because sometimes this worrying thing about your partner will leave is a thing.
No, it's a thing.
Where you're worried that, if I can't give him sex and he might get it out there or he might leave me for it. So how do you help women with their mental health?
So I think the first point of contact is for somebody to realize there is a problem. Okay. But even before that, I think for me as a gynecologist, especially for my consultations, the very first consultation is always a lengthy one. I want to find out how your life is. I want to find out, have you ever had previous operations? If you've given birth before, what was that like? I want to know about your support structure. I want to know what is actually happening in your life, so that I know where my point of contact is going to be, or where my intervention is going to be, okay? Because I always say, a lot of people don't like going to the hospital, they like going to the doctor. So if I'm going to see you in front of me, let me maximize that by being able to come in where I need to. So I think that's the first point where I do, identifying the problem. And then talking through it. Sometimes you might feel somebody's just frustrated because they don't know what's happening with their body. They don't know how to communicate that, okay? And me then helping them to understand what's happening with their body. It goes a long way, information goes a long way. And being able to anticipate problems goes a long way. If you tell somebody you have a decreased libido if you're on contraception, they'll think about it and then they can be able to work around it. Yeah. Okay. So I offer that, okay? And I think I also tell my patients all the time, bring your partner to the consultation. If there is a problem you can't talk about, allude to it in the consultation, and then I will take it further, because it's easier for me to tell your partner, your husband, that these are the actual issues and that this is what we're dealing with, okay? And then you then having to start the conversation because you're worried about a whole lot of things, how the conversation's going to go, if it's not going to end up in a fight or any of that. So I like to bring that into my consultations with my ladies, so that and then also give them tips on how to bring those conversations into light, It's the funny thing is, like, whenever my husband wants to talk about something, sometimes he'll send me a clip,
like clipping and maybe, and then we start having a conversation about it. Yeah.
He'll send me a clip about something, and then I'll be like, okay, this is a conversation that we need to have, and then I'll respond to the clip, and then later on we'll sit down and have a chat related to that. So that is some of the tips that you'll give to my ladies, to say, this is a conversation starter, or around about that. So, and then I always emphasize that doing good for yourself is going to translate in good around you. So if I'm overworked, I'm tired, I'm sleep deprived, I'm not doing good for myself, I'm not resting well, you're going to see it around
Of course.
yourself. You know, your kids are not going to be well, you know, your work is going to suffer. Okay. So take the time for yourself. It's okay. And we always feel guilty about it, you know. Oh, but I've got so much money, I must buy my kids clothes, you know. Or if you're going to the shop, I forgot, I need to buy this grocery, this and that, everything else. That's how we wired. That's how we set to think. Say, okay, I've dealt with you guys. Now I'm taking time for myself, you know. Early mornings, you know, quiet time for yourself. Time to think, time to plan, you know. I always suggest that to my ladies. You know, some people will be like, oh, but I can't do the whole meditation thing. It's okay. Then do what's good for you, you know. If you want to sit by yourself and watch something without having somebody to ask you to make a meal or a juice or drop me off or pick me up, it's okay. You must take that time because you need to rejuvenate yourself so that you can be able to treat the people around you well. You know, I have a friend of mine who always say, pour into your cup, you know, before you can be able to pour into other people. So that's what I think I bring for my ladies in terms of my practice, in terms of how I help in terms of the mental health state, you know. And yes, I do have a psychologist, which I like to work with, okay? So if I do pick up something that's more than just the conversation, I know how to refer appropriately, you know. Or if I find that maybe a psychologist might not even help, I need a psychiatrist, you know, the next level of care, then I refer to them, and then that holistic care then comes into play, you know. Or if I pick up something that needs a surgeon or something else or someone else, or you have another issue that might not be gynae related, that's probably affecting your life in a way that you need help, refer, you know, so that you can get maximum amount of help all around in order for you to then be well in terms of your mental health.
I hear you. And I think like what you said in the beginning, why is it that talking about sex is so taboo, even with our partners?
It is.
I'm not talking about it online or I'm just saying with the people that we love, with the people that we married to. Why can't I just say,
I want sex.
I want sex.
I want sex.
Gay bad.
Yeah. I mean, society and culture has done it like that. Why do I want sex? Why do I have a high libido? Why must I initiate?
Yeah.
Why must I want you? You know? Because then it translates to the opposite. Oh, you're a whore, slut, or something like that. You know what I mean?
Yes.
So people who want sex a lot are people like that. But a healthy sexual relationship and being able to have those conversations, it's your person. If you don't do it with your person, who are you going to do it? So if you want to be that kind of person, you must be with that kind of person with your person.
Yes.
You know?
Yes.
And they and you find that they enjoy that part of you. Yeah. And then you stand there and you're a prim and proper person, you come back home and you have those conversations with your husband or your partner and you're able to then, you know, connect sexually, because a lot of people are like, men always just want to have sex, you know, that's all they over talk about. But men need, well, in inverted commas, need sex to be able to feel close to you as a partner. Of intimacy, yes.
Yeah.
And maybe your form of intimacy is just sitting together and having those conversations, or sitting together and watching a movie, physical touch, all of that. But also, it then, you know, brings it holistically. So your part of things is sorted, his part of things is sorted, and it helps in the whole ecosystem of the relationship.
Yeah.
So we must have sex conversations.
Yes,
it's very important.
Yeah.
I had a lady, but I had a lady who came into my rooms, and she was saying, Guti, she was a virgin throughout her life. She only got married at a later stage in her pregnancy. In her life. And now they were trying to have make a baby because she had been married about a year ago. And now she was worried, oh my goodness, I'm not able to make a baby. Is there something wrong with me, you know? And then also, like, unpacking that conversation leads to her saying, you know, sex is painful, you know? And she's scared to then tell her partner that sex is painful because she's been a virgin her whole entire life. So now she needs a little bit more care and a little bit more love when it comes to it, you know. The foreplay needs to come into play. And also she's like shy.
To feel safe.
Yes. Yeah. And so being able to have that conversation, facilitates in feeling safe. Feeling safe means you're more relaxed.
Absolutely.
More relaxed means more enjoyable sex.
Yeah.
Okay.
Yeah.
And I think partners need to understand that. Okay. It's not about here now. Let's go.
Yeah.
You know, it's about bringing me into this. And also the other thing to remember is that sex doesn't only start in the bedroom,
Hey.
especially for us women. Okay. So for a man, yes, let's go. But for me, it's the romantic side of
Are
things,
you
you know.
home safe?
Yes.
Did you eat?
Exactly.
Hey, whenever they look at us and they're
Yeah.
fine. Or now it's not even, you can look at a hot man and still don't want to have sex with
Exactly.
them. But when they start communicating with you
Yes.
and checking
Send
up
you
on you,
flowers.
sending you flowers, umama
Did you
unjani,
eat?
endlini, all those
Yes.
little questions.
I
like,
know today you
"Oh,
had this, you know. So are you okay? You get home, there's a little bit of a touch. Walk past you, there's a little bit of a
yes."
brush.
And then we clean some mole wa donos,
You know?
and then
And then
the rest is
the
history.
rest is history. So by the time you get there, the
Yes.
stage has already been set.
Yeah.
Partners need to understand that. They need to know that what you do during the day
Yeah,
is going to equal to that.
absolutely.
Yes.
Yes.
Yeah.
Doctor, thank you so much for
Oh my
coming. I had such a
goodness.
lovely comment. I feel like we need part 2.
You know?
Yeah, we must come back for part 2. Rebueka,
All those
But all those,
recent
yes,
things.
everything that has to do, because like you said, even me, I was like, okay, am I going to call it vagina or span? Because we also don't want to, we name things because we're scared to say
Say the
it's
name.
a vagina.
It
It is what
is
it
a
is.
vagina.
And then we name this our spatch.
Yeah.
Sparkle.
My
Yay.
flower.
My flower. As a flower.
As if a
Vagina.
vagina.
Thank you so much for watching Mommy Diaries.